Hello guys, welcome back again. So guys, today's video is going to be about how to treat the severe asthma attacks. Let's get started. So friends, asthma is a chronic inflammatory condition of the respiratory system characterized by episodes of cough, wheezing and dyspnea or difficulty breathing. It primarily affects the airways, causing them to become hypersensitive and reactive to various environmental triggers. This condition can manifest episodically, meaning symptoms can come and go, and is often reversible, although severity can vary significantly among individuals. Approximately 80% of people with asthma exhibit allergic tendencies known as atopy, which are frequently confirmed through skin tests. The symptoms can vary widely, including wheezing, chest tightness, and shortness of breath. These episodes may occur several times a day or week, with some individuals experiencing more severe symptoms at night or during physical exertion. So friends, the frequency and intensity of symptoms can differ among individuals. Some may experience infrequent symptoms, while others may have persistent or recurrent episodes. Asthma is thought to arise from a combination of genetic and environmental factors. It is the most common chronic respiratory disease in children, with a large percentage developing symptoms before the age of 5. The condition is categorized into two main types: extrinsic asthma, triggered by allergens, and intrinsic asthma, which is not linked to immune responses and can be caused by various irritants. Now, common environmental triggers include allergens like dust, mites, pollen, pet dander, and mold, as well as air pollutants such as cigarette smoke and vehicle emissions. Additionally, respiratory infections, particularly viral infections, can exacerbate asthma symptoms. Stress, exercise, and changes in weather can also lead to heightened symptoms in some individuals. For a subset of asthma sufferers, medications like aspirin or non-steroidal anti-inflammatory drugs may provoke symptoms by altering inflammatory pathways. When individuals with asthma are exposed to these triggers, their airways undergo inflammation and narrowing, leading to increased mucus production and bronchospasm. These physiological changes make it difficult to breathe and can pose significant health risks too. During an asthma attack, the smooth muscles around the bronchi may constrict, causing acute airway obstruction. This process can lead to severe breathing difficulties, which can be life-threatening without prompt intervention. Diagnosis typically involves evaluating the patient's history of symptoms and conducting tests, such as spirometry, to assess airflow obstruction. This diagnostic process is crucial as it helps identify patterns of symptoms, particularly any correlations with specific environmental factors or triggers. Now, a detailed patient history is essential for recognizing recurrent symptoms of wheezing, coughing, and difficulty breathing, especially if they worsen with exercise or exposure to allergens. Guys, management strategies focus on preventing exposure to known triggers and alleviating symptoms too. While there is no cure for asthma, various treatments are available to help control symptoms and reduce the frequency of attacks. The most effective management involves identifying triggers such as tobacco smoke, pets, or specific allergens, and minimizing or eliminating exposure to them. Medications play a crucial role in asthma management. Common treatments include bronchodilators, which relax the muscles of the airways, allowing them to open up and facilitate easier breathing. Inhaled corticosteroids are frequently prescribed to reduce airway inflammation and prevent asthma symptoms. For individuals experiencing more frequent symptoms, higher doses of inhaled corticosteroids may be necessary, while those with severe exacerbations may require systematic corticosteroids or additional treatments. Preventive measures are also important in managing asthma. The World Health Organization recommends reducing risk factors such as exposure to tobacco smoke, air pollution, and respiratory infections. Environmental modifications such as using air purifiers and maintaining a clean living space can also help minimize asthma triggers. So guys, in summary, understanding the symptoms of asthma and recognizing their triggers are vital for effective management of the condition. While asthma is a chronic disease with no definitive cure, appropriate treatment and lifestyle adjustments can help individuals lead active, healthy lives. By implementing effective management strategies, those affected by asthma can significantly reduce the frequency and severity of their symptoms, ultimately improving their overall quality of life.
If you like this video, please like it and share it with your friends. And don't forget to subscribe to our channel for more health-related videos.